Delirium is a serious and often misunderstood condition that can have a significant impact on a person's mental state. It is characterized by sudden changes in a person's awareness, often leading to confusion, disorientation, and difficulties with concentration and memory. A person with delirium might be alert and coherent one moment and confused or agitated the next. They may have difficulty focusing on a conversation or task, and their attention may wander. Unlike dementia, which develops gradually over time, delirium usually comes on quickly, sometimes within hours or days, and can fluctuate throughout the day. What's important here is that delirium is not a disease in itself, but rather a syndrome, which simply means a collection of symptoms that can have various underlying causes, which we will get to in a minute. But now, how common is delirium? Well, delirium is surprisingly common, especially among older adults, particularly those who are hospitalized, undergoing surgery, or in intensive care units. In hospitals, it's estimated that about 10 to 30% of medical patients and up to 50% of surgical patients experience delirium at some point during their stay. The numbers are even higher in intensive care units, where up to 80% of patients may develop delirium. In nursing homes and long-term care facilities, the prevalence can range from 20 to 60% of residents. Types of delirium. Delirium can manifest in different ways, and medical professionals typically recognize three main types. Number 1. Hyperactive delirium. This type is characterized by increased activity, agitation, and restlessness. People with hyperactive delirium may become aggressive, have hallucinations, or try to remove medical devices. Number 2. Hypoactive delirium, often called quiet delirium. This type involves decreased activity and alertness. People may become withdrawn, sleepy, and less responsive to their environment. Number 3. Mixed delirium. This type involves fluctuations between hyperactive and hypoactive states, sometimes within the same day. Causes of delirium. The causes of delirium are numerous and varied. One of the most common causes is medication side effects, particularly in older adults who may be taking multiple drugs. Certain medications, especially those that affect the brain, such as those with anticholinergic effects, sedatives, and narcotics, can trigger delirium. Alcohol or drug withdrawal can similarly cause delirium, particularly in individuals who have been using substances for a long time. The sudden removal of these substances from the body can lead to significant chemical imbalances in the brain, triggering confusion and other symptoms of delirium. Infections are another major cause, especially urinary tract infections and pneumonia in older adults. The body's response to infection, including fever and inflammation, can affect brain function and lead to delirium. Similarly, any condition that affects oxygenation of the brain, such as heart failure, lung disease, or severe anemia, can contribute to the development of delirium. Another major cause of delirium is a sudden change in environment, particularly in vulnerable populations such as the elderly. Hospital stays, for instance, can lead to what is known as hospital delirium, where the unfamiliar surroundings, disruption of normal routines, and sleep disturbances can combine to cause confusion and disorientation. Finally, metabolic imbalances and organ failure can also play a role. For instance, dehydration, electrolyte imbalances, liver or kidney failure, and thyroid problems can all precipitate delirium. Symptoms of delirium. The symptoms of delirium can be wide-ranging and often fluctuate throughout the day, typically worsening in the evening and night, a phenomenon known as sundowning. However, the most obvious symptom is confusion and a disturbance in attention. A person who was previously alert and focused suddenly becomes confused and disoriented. They might be easily distracted or unable to focus on simple tasks, or even not knowing where they are or what time it is. Memory is also often affected, with recent events being particularly hard to recall. The person might not remember why they're in the hospital or what happened earlier in the day. Their thinking becomes disorganized, and they may have trouble expressing themselves coherently. Some individuals also experience hallucinations, seeing or hearing things that aren't there, while others may have delusions, which means holding false beliefs about their surroundings or the people around them. Generally, the experience of delirium can be extremely distressing. People often report feeling scared, confused, and out of control. They may not recognize familiar faces or understand where they are. The world can also seem threatening and unpredictable. Diagnosis of delirium. Diagnosing delirium can be challenging, particularly because its symptoms can mimic those of dementia or psychiatric disorders. Dementia, for instance, causes a gradual decline in cognitive function over time, while delirium comes on suddenly. However, in some cases, particularly in individuals with pre-existing dementia, delirium can be mistaken for a worsening of their dementia symptoms. So, the key is recognizing the acute onset and fluctuating course of symptoms. A thorough medical history is crucial, often relying on information from family members or caregivers who can describe the person's baseline mental status and how it has changed. Several assessment tools are used to diagnose delirium. One of the most common is the confusion assessment method, which evaluates four key features: acute onset and fluctuating course, inattention, disorganized thinking, and altered level of consciousness. If a patient shows the first two features and either the third or fourth, delirium is likely. Physical examination and laboratory tests are essential to identify underlying causes. These might include blood tests to check for infections, electrolyte imbalances, or organ dysfunction. Brain imaging, such as CT or MRI scans, might be ordered to rule out neurological causes like stroke or brain tumors. Treatment for delirium. Treating delirium focuses on addressing the underlying cause. If the delirium is due to an infection, antibiotics are typically prescribed to treat it. If dehydration or electrolyte imbalances are to blame, fluids and electrolytes will be administered to restore balance in the body. When medications are identified as the cause, adjusting or discontinuing those medications may resolve the delirium. In cases of alcohol or drug withdrawal, detoxification and supportive care are necessary to help the person through the process safely. At the same time, supportive care is crucial to manage the symptoms of delirium and prevent complications. Creating a calm, supportive environment is an important part of treatment. This might involve ensuring a quiet room with adequate lighting, maintaining a regular sleep-wake cycle, and having familiar objects or people around. Frequent reorientation can help, gently reminding the person of where they are, the date, and what's happening. In some cases, medications may be necessary to manage symptoms, particularly in cases of severe agitation or hallucinations. However, these are used cautiously, as many medications can potentially worsen delirium. When needed, low doses of antipsychotic medications are often the first choice. Recovery from delirium can vary. In many cases, especially when the underlying cause is promptly identified and treated, delirium resolves within a few days to weeks. However, in some cases, symptoms can persist for months. Even after the acute episode has resolved, some people experience lasting effects on cognition and functioning. Now, we want to hear from you. Have you or a loved one ever experienced delirium? What are some strategies or tips you found helpful in preventing confusion or delirium in a hospital setting or during recovery? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.